Hello, my name is Bridget Reed, and I'm going to be talking to you guys today about the Braden scale and what it's used for. I've been an ICU nurse for 7 years now. I've provided some PowerPoint presentations. If you guys want to take some and pass them down, you can, so you can follow along with me. First of all, I just want to go into what exactly the Braden scale is. It is a scale that is used to prevent pressure ulcers, and individuals at risk must be identified so that the risk factors become reduced through nursing intervention. It's also used to determine the magnitude of risk and the degree to which mobility and activity levels are limited and can be quantified. There are numerous risk assessment tools that exist out there, but the Braden scale and the Norton scale are the only two that have been tested extensively. It is a scale that is made up of 6 subscores that are numbered 1 through 4. 1 for the lowest level of functioning and 4 for the highest level of functioning. The total of scores range from 6 to 23. There is one subscale that is scored only through 1 through 3. The subscales measure the functional capabilities of the patients and contribute to either the intensity that contribute to the duration of pressure or lower tissue tolerance for pressure. A lower Braden score indicates lower levels of functioning and thus a higher level of risk for pressure ulcer development. One of the first categories that you rate your patient on is sensory perception. 1 would be completely limited. Your patient would be unresponsive, they don't respond to painful stimuli, or they have limited ability to feel pain. A lot of these patients would be either paralyzed or in a coma, whether it be medication-induced or related to some other neurological problem. Number 2 on sensory perception is considered very limited. These patients are the ones that only respond to painful stimuli, or they have sensory perception deficits that affect at least over half their body to where they're unable to sense pain or painful stimulus. Number 3 on sensory perception is slightly limited or responds to verbal commands, but can't always communicate their discomfort levels or the fact that they need to be turned, and they have a loss in 1 or 2 of their extremities for sensation. And number 4 would be no impairment. This person has no deficits that would limit their ability to feel or voice their discomforts. The second subcategory is moisture. Number 1 would be constantly moist. Every time that you encounter this patient, they are moist and require a linen change. Number 2 would be very moist. The skin is often but not always moist. So about every other time you're going and making a patient encounter, this would require a linen change. 3 is occasionally moist, which just means occasionally they are moist, requiring about 1 extra linen change a day. And 4 would be rarely moist, where the skin is usually dry and only requires routine linen changes. Another category is activity. A level 1 on this would be where the patient is bedfast or confined to bed. Number 2 would be chair fast, where they have the ability to walk, but it is severely limited and they must be assisted to the chair or wheelchair by nursing staff. 3 would be walks occasionally. These patients can walk very short distances, but spend the majority of your shift or wakeful hours in the bed or chair. And number 4 would be they walk frequently. They walk outside the room at least twice a day and inside the room at least every 2 hours while they're awake themselves without assistance. The next category is mobility. A number 1 would be completely limited. They do not make slight changes in their body movements or extremity positions without assistance from nursing staff. Number 2 is very limited. These patients are the ones that make occasional slight changes in their body or their extremities, but they're unable to make frequent or significant changes by themselves. So those would be the ones that the nursing staff still assist them quite frequently. Number 3 is slightly limited. These patients are the ones that are capable of making slight movements in their body or extremities independently. And number 4 would be no limitations. So they're able to make major and frequent changes in their body positions without assistance from any nursing staff. The other category that you score your patient on is nutrition. And number 1 would be very poor nutrition. These are your patients that never complete a meal that you are offering them, or they eat less than 1/3 of the food that's offered, or they're NPO or have been on clear liquids for more than 5 days. Number 2 is probably inadequate. These patients rarely complete a meal, about less than half of the food that is offered to them, and they're not at their goal of their liquid diet or tube feedings if they're on tube feedings. Number 3 is adequate. These patients eat over half their meal at all times, or at least during most meals, and they are either on tube feeding or TPN regimen that more than likely meets their nutritional needs or at their goal rate. Number 4 would be excellent. These patients eat most of all their meals daily. They occasionally eat in between meals with snacks, and they don't require any supplements. Your next category that you're rating your patient on is friction and shear. Number 1 would be problem. These require moderate to maximum assistance in moving. They need complete lifting, and they slide against the sheets pretty much every time you move them. Moving them without having them lift up the sheet and slide against the sheet would be impossible. And they frequently slide down in the bed or the chair. Number 2 would be a potential problem. These patients move freely and require minimal assistance, but during a move, their skin probably slides against the sheets to some extent or degree. And number 3 would be no apparent problem. These patients have sufficient muscle strength to move up and lift themselves up completely in the bed during their move, and they maintain good position in the bed and the chair all day long. I'm going to go through a couple of scenarios where you would rate your patient based off of your clinical assessment. You have a patient that's admitted to the ICU, they're on a ventilator, and they're chemically paralyzed, and their tube feedings have been off or at least less than half their goal rate for the last 3 days due to high residuals. They do have an indwelling catheter, and they've had no reported bowel movements in the last 4 days. What level of braden score would you give them? The answer is 9, which is a high risk for potential skin breakdown due to their immobility and them not meeting their nutritional needs and their requiring of complete assistance with moving. Nurses use the Braden scale as a tool to determine whether their patients are at high risk for skin breakdown. When you use it varies on clinical area and the stability of the population. Coming from an ICU area, most ICU areas typically use a Braden scale at least once a shift. You may not have to do it with every assessment, but you do it at least once a shift, which is twice in a 24-hour period at least. Most acute floor settings or med-surg floors will use it at least once a day. A lot of times they're night shift, because the shift is typically a little slower, will be responsible for doing the Braden score. And then the Braden scale is actually recommended by to be used at least with every RN visit for any home care nursing visits. Is there any questions or concerns that anybody has? All right, thank you for your time.